navigate healthcare today can really feel, well, like you're lost in a maze sometimes. So many different doctors, clinics, specialists. It's just, it's easy to feel overwhelmed by the sheer complexity.
Yeah.
Something a recent white paper from Serefin Health actually visualizes right up front.
That image, you mean? The one with the patient in that web of disconnected providers. It really hits home, doesn't it?
It really does.
And it perfectly sets up what we're diving into today.
Yeah.
Care coordination.
Exactly. Now, this isn't just, the usual care management you might find within one hospital system.
Right.
The information we're looking at, mainly this white paper from Serefin Health, Bridging the Gaps with Care Coordination, it talks about a specific professional model. It sounds much more proactive and integrated than maybe what we're used to.
That's a really key distinction, actually. Traditional care management often looks at the bigger picture, longer term stuff. This professional model, it's more about the nitty gritty, the immediate, efficient organization and sort of synchronization of services. Think of it like the connective tissue, maybe, holding everything together for the patient.
Okay, I like that analogy. So our goal today is really to get our heads around how this professional care coordination model works and, what potential it has to make things better for patients, obviously, but also the system overall. The white paper kicks off by outlining some pretty big challenges we're facing in healthcare right now.
It really does. It points straight at things like just how hard it is to get the right care sometimes.
Yeah.
And these huge information gaps between different doctors or clinics.
Oh, definitely.
And just plain inefficiency in how we use resources. They use examples we can probably all recognize, like a mom desperately trying to find help for a sick kid, or a family just completely lost trying to manage elder care.
Right. Those aren't just like one-off stories. They represent bigger systemic problems, don't they?
Exactly. They're symptoms of something larger.
And it's not really that hard to see why these problems are happening or maybe getting worse. The paper mentions a few factors, like the rising number of people with chronic illnesses. That alone puts more strain on everything.
For sure. And then you add in the workforce shortages.
Yeah.
I mean, the WHO projection about nurses and midwives by 2030 is pretty stark.
Wow. Yeah.
Plus, that stat from 2023, what was it, 17% of Canadian adults didn't have a regular doctor? That lack of a home base in the system creates its own set of headaches.
Absolutely. And the system itself often feels like it's built for, sudden acute problems, not the ongoing management the chronic conditions need.
That's a great point.
Plus, sometimes the public and private sectors don't seem to talk to each other very well, which just adds another layer of confusion. And we can't forget the admin burden on doctors. All those hours spent on paperwork in Canada alone, that's time not spent with patients.
It's huge. And, what's interesting is the perspective from Skip Schwartz at Serefin Health. He mentions the aging physician workforce and how new grads are often going into specialties.
Right.
His idea, grounding primary care and project management principles with care coordination as the core, that feels like a really practical way to think about it.
Project management for healthcare. It's an interesting way to frame it. Okay, so the white paper then moves into the solution, really hammering home this idea of professional care coordination as like its own dedicated skill set.
That's the heart of it, really. I mean, think about other complex industries, construction, tech, whatever. You have people whose job it is to manage the project, keep everything on track.
Sure.
Healthcare, for all its complexity and importance, often hasn't had that same dedicated professional approach to coordination across different providers and settings.
So the Serefin Health model is built around these specialized professionals.
Yeah.
Their main job, their only job really, is coordinating a patient's care journey across all the different players.
Exactly.
The paper lists their key functions, overseeing the whole spectrum of care, using standardized processes, leveraging technology.
Using tech to help, not replace.
Bridging those gaps we talked about, and always focusing on the patient.
That's the goal. And for patients, the benefits could be pretty significant. Getting the right care for the right person at the right time, that's the promise. The paper suggests this also leads to measurable improvements, in efficiency, in actual health outcomes, plus just having consistent support through it all.
And when you look at what these care coordinators actually do day to day, it's pretty involved. They're making sure information flows smoothly. They're managing appointments, referrals.
Developing care plans, monitoring them.
Right, and educating patients, connecting them with resources they might not even know exist.
And it's not just about the appointments themselves. It's the before and after support, too. Making sure people are prepared for a visit and know what to do afterwards.
Keeping that communication going.
Exactly. Ongoing communication.
Yeah.
And even gathering data to help see where the system can improve. It's very hands-on.
Okay, this leads into an idea they illustrate called a harmonious health system structure. It shows the three main players, right?
Yeah, you've got the service payer, so governments, insurers, the ones footing the bill.
Okay.
Then the service beneficiaries, the patient, their family, caregivers.
Us.
Right, us. And the service provider, the doctors, nurses, hospitals, everyone delivering the actual care.
And the paper argues that while these three should work together smoothly, often the reality for the patient is, well, it's fragmented.
Very fragmented.
Okay.
And the diagram shows care coordination, sitting right in the middle, acting as that central connector, linking the patient directly to all the different providers they need.
So it becomes the main point of contact.
That's the idea.
Yeah.
To simplify things for the patient, definitely, but also to help the providers by making communication easier, getting them the info they need faster.
And data is a big part of this too, it seems.
A very big part. The paper points out how coordination helps track things like what services are available, how much they're being used, where patients are going for care.
Finding the gaps.
Exactly. Identifying unmet needs. That kind of data is gold for planning and deciding where to put resources.
There's a quote in there from Constance Sugiyama that touches on this, right? About how coordination can help people get the right level of care.
Yes, potentially keeping them out of the hospital or long-term care if they don't truly need it. Helping more people age at home, which most people want.
Right. It's about optimizing the whole flow.
Precisely.
And they clarify the terms too, which is helpful. Care management is the overall plan. Care coordination is the how, organizing it all. And care delivery is the why, or maybe the actual doing.
Yeah, the doing, the hands-on care. That distinction really isolates what professional care coordination is. It's the engine trying to make that patient-centered plan actually happen smoothly.
Now, technology, Serefin Health's approach seems to really integrate tech, but they're careful to say it's not just about the tech.
Right, they call it a high-touch solution. The idea is using technology like AI to support the human care coordinators, make them more effective.
How so? What kind of things can the tech do?
Well, the AI and digital tools help the humans manage the load, basically. It gives patients a consistent contact point, but behind the scenes, it helps the organization analyze data, figure out the best care pathways, things like that.
The paper gives examples like multilingual support, maybe initial symptom checks.
Yeah, we're automating follow-up calls after discharge, transcribing calls, helping track if people are taking their meds, routine stuff, often.
But the decisions, the conversations, that's still the human coordinator.
Absolutely. Humans make the calls and talk to the patients. The tech is a tool to augment them.
Paul Method's perspective on AI being necessary because of staff shortages makes a lot of sense too.
It does. If AI tools can handle some repetitive tasks, it frees up nurses and doctors for the complex human stuff.
Reduces that admin burden we talked about.
Exactly. And the virtual aspect is key too, right? Being able to coordinate care remotely opens things up for people in rural areas or who have trouble traveling.
Yeah, huge potential there. Okay, so the model isn't rigid. The paper talks about customizable elements. What does that mean in practice?
It means that while the core functions are there, how it's applied can be tailored. You work with the patient to set goals.
Okay.
You provide education based on solid research, connect them to specific community resources that fit their needs, not just a generic list.
So it's personalized.
Very much so. Identifying gaps in their specific care plan, advocating for them, helping them learn to manage symptoms or medications.
It also mentions support during transitions, like hospital to home.
Crucial. Those transitions are where things often fall apart. So managing that, plus regular check-ins, ongoing monitoring.
And caregiver support too. That's often missed.
Hugely important. Caregivers are part of the team. So yeah, it's about providing that continuous, adaptable support throughout the whole journey.
All right, let's look at care coordination in action. The paper breaks it down into 8 areas. First up, neurodiversity and autism care.
Yeah, this is an area where Serefin Health seems to have a lot of experience. The paper notes the unique strengths of neurodivergent people, but also the prevalence, like 1 in 100 kids with ASD.
And their approach.
Very person-centered, recognizing that the individual and family are the experts on their own needs. It emphasizes flexibility, individual plans. They mention working with Access OAP, using a large team of coordinators.
There's an anecdote in there, isn't there, about a family feeling isolated?
Yes, raising an autistic teenager feeling completely alone. The care coordinator connected them with counseling, respite care, basically gave him a lifeline, renewed hope.
Wow. That really shows the impact, bridging those gaps to get specialized support.
Absolutely.
Okay, next, primary care. The foundation, as the paper calls it.
Right. And we already touched on the access issue, so many people without a family doctor.
And the admin burden on the ones who are practicing.
Exactly. Dr. Veer Kohut talks about coordination here being about proactive intervention, helping patients navigate the system, but also understanding their basic human needs, especially if they're facing barriers or lack resources.
Makes sense. Then pre- and postnatal care.
A critical time for mom and baby. The paper stresses a team approach and mentions research linking coordinated care to fewer premature births.
And postpartum support is vital too.
Definitely. Especially with concerns about maternal mortality rates in some places. Models like midwifery care often have strong coordination built in. Professional coordination can help ensure everyone gets that level of support, especially in underserved areas.
Okay. Emergency and urgent care. The big challenge here seems to be follow-up, right?
Yeah, what happens after the ER visit? The paper mentions patient navigation programs in the ED helping reduce return visits. And that statistic, half of doctors not even knowing their patient went to the ER.
That's shocking, really. Shows a major disconnect.
It really does. So coordination here is about smoothing that transition out of the ER, reconnecting patients with the regular care team, getting them the follow-up they need.
All right, next is chronic and complex care. This affects a huge number of people.
Millions. And it puts a massive strain on the system and on families too. Caregiver burnout is real.
The paper gives some strong examples of benefits here, like that Ontario initiative cutting down ER visits in hospital stays significantly.
Yeah, impressive numbers. And that story about the person with the undiagnosed neurological condition, the care coordinator just kept pushing until they got answers.
That persistence is key.
And the data on diabetes care improvements, better A1C, blood pressure, patient satisfaction, it all points to coordination, making a tangible difference.
It also tackles the myth of universal electronic health records.
Oh, yeah. The reality, especially in Canada, it seems, is quite different. Doctors often can't easily share info electronically, and patients have limited access to their own records.
Dr. Kohut's frustration about that really comes through.
You can feel it. Hampers good care when information isn't shared properly.
Okay, moving to mental health. The paper paints a picture of a global crisis, really.
It's stark. 1 in 8 people globally. 1 in 5 Canadians experiencing depression at some point. Suicide rates among youth, it's sobering.
And mental health being the leading cause of years lived with disability.
Yet funding often doesn't match the need, or is skewed towards hospitals instead of community support and prevention.
And the pandemic made things worse.
A 25% jump in anxiety and depression, according to the WHO. The paper does highlight that collaborative care models work well, though.
So where does coordination fit in?
It offers that personalized support, helps people find the right resources, which can be confusing in mental health, works on reducing stigma, and provides proactive support to try and catch crises early.
Got it. 7th area, aging and elder care. We touched on this, the growing older population.
Right. And the communication gaps that can happen between doctors and home care providers. That's a big issue.
Especially since most people want to age at home. That 96% figure for Canadians is striking.
It is. So coordinating home care, medication, especially if there's cognitive decline, becomes absolutely vital. It helps seniors stay independent longer and supports their families too.
Okay, finally, palliative care.
Addressing the needs of people nearing the end of life. Complex, evolving needs. The paper mentions a study listing barriers, communication issues, attitudes, money.
Lots of hurdles.
But coordinated palliative care can make a huge difference. Reducing anxiety, avoiding unnecessary hospital stays, just improving quality of life for the patient and the family.
And starting it early seems important.
Yes, integrating it early in a serious illness often leads to better symptom control and better outcomes overall.
So the potential seems clear, but the white paper also talks about barriers to actually implementing care coordination, like the belief that it's already being done well enough.
Right. The paper kind of pushes back on that, saying truly effective coordination needs a system-wide view, connecting across different organizations, not just within one silo.
And cost is always a factor.
Always. But the argument here is that it's an investment. You might spend up front, but you save long-term through efficiencies, fewer hospital visits, better health. It pays off.
What about staffing? Does adding coordinators just add more bodies?
The paper frames it differently. It sees coordinators as support that frees up doctors and nurses by handling the coordination tasks. letting clinicians focus on clinical work.
Okay, so it potentially helps with capacity issues.
That's the idea.
And the last barrier mentioned is just the difficulty of implementation, changing workflows, integrating tech.
Yeah, change is hard. Serefin Health suggests their approach is designed to integrate smoothly, minimizing disruption for the existing staff. It's about fitting into the system, not adding another layer of complexity.
Right, streamlining, not complicating.
Hopefully.
Okay, so in the empowering action part, they speak directly to the different groups. The payers, government, insurers.
For them, the message is, this leads to a more efficient, sustainable system, better value for money, better outcomes.
And for providers, doctors, nurses.
It means better teamwork, better results for their patients, and maybe, just maybe, less burnout because of smoother processes and communication.
And for us, the patients, the beneficiaries.
For us, it promises care that's easier to access, more continuous, more personalized. It empowers us to be more involved in our own health.
So the overall call is for collaboration, putting the patient truly at the center, with coordination as a key piece of making that happen.
That sums it up well. A patient-centered future built on better coordination.
So let's try to wrap up our deep dive today. We've really explored how complex healthcare has become and how this idea of professional care coordination, as laid out in the Serefin Health paper, could be a powerful way to bridge those gaps we keep talking about.
Yeah, improving access, communication, efficiency across so many different areas, from neurodiversity to palliative care.
It really champions a holistic person-first approach, doesn't it? Blending that essential human support with smart technology.
Exactly. It's not tech for tech's sake. It's tech enabling better human connection and better care navigation.
So as we finish up, maybe something for you, the listener, to think about. Reflect on your own experiences or maybe those of your family or friends navigating the healthcare system. How might a more coordinated approach, like the one we've discussed, have changed things? What would better managed care look like for you? It's definitely something worth mulling over as we all try to make sense of healthcare today.